Welcome back and happy celebratory month, everyone. It is IBS Awareness Month. That was brought to my attention by our dearest Amy. Thank you for bringing this to my attention, darling. We have so much to talk about to make people more aware of IBS here on the IBS Freedom Podcast. No, I'm joking, right? But I do want to start right out the get-go with this episode and say, you recently came under a little bit of fire. I think it all worked out. It was all okay, but I was creeping on the Instagram recently. I was kind of getting my feet wet back on the Instagram again since I took a hiatus with the move. And you had done a post. Well, I mean, you could tell it if you want, but you had done a post saying that IBS is a bullshit diagnosis, or something to that effect, right?
Right.
And somebody kind of took issue with that. Do you care to tell the story, or I could try to rehash it from my memory?
Yeah. So, I think again, basically what I posted was, it's very frustrating when you go to the doctor or whatever, and they say, okay, you have IBS, which essentially just means that they can't really figure out what's going wrong. Nothing on the testing came up. So, it's just IBS. It's sort of It's a wastebasket diagnosis.
We ruled out Crohn's. We
Right.
ruled out celiac disease.
Right. So I basically was just saying that, you should dig deeper and kind of get to the root of what's actually going on. And again, I think I mentioned, push back a bit, with your doctors. I didn't even mention doctors, but push a little bit further to try to dig deeper in the video. And essentially it's just you should be digging deeper to the root cause. You should be trying to figure out what's actually driving the symptoms and not just accepting your gut's irritable with the IBS diagnosis. So then, and I actually I appreciated her perspective in a way. But there was a lady that came on that was saying kind of that I'm trying to remember exactly what she said, but that I was kind of, what's the word that she used? Let me see if I can pull it up.
While you do that, I think my takeaway was that it can be maybe equally frustrating to be told that your new diagnosis is a trash diagnosis. I think maybe there was a vibe of that to it, which I do get, right? For some people, getting a label, getting a diagnosis is still a sigh of relief in some way.
Right. So that's what she was saying. She was saying that maybe I was invalidating their symptoms.
There you go. That's the word.
Which, to me, again, I would never want to do that. I think my sort of takeaway is, we should be doing more. Again, if you get a diagnosis where it's okay, we don't really understand what's going on, I do think there has to be some digging. Because it's equally going to be as frustrating if you just have these symptoms that are then labeled IBS. But it can be I think there is something valuable about saying, okay, you have this dysfunction and we're giving it a label. And again, that was, I think, her point is you don't want to invalidate someone's experience, which is not my intention at all.
Yeah. Well, and I thought that was, it was a useful point of view to share. But also, I think that, acknowledging that there are diagnoses. Well, hold on. First of all, I'm going to back up and say you should always dig deeper, no matter what diagnosis you receive. I don't care if it's a Crohn's diagnosis, a celiac diagnosis, a cancer diagnosis. You want to dig deeper and try to understand the root causes and the physiology deeper so that you can treat it more effectively, right? So even if it's a disease where we have more of a clear understanding about it, I think the sentiment of you want to keep pushing and digging deeper and getting more answers, I think that's really useful. Now, there are diseases let's say, Crohn's or celiac disease, where at least we know the mechanism more precisely. where it's like, okay, there's autoimmunity, and therefore we can speculate that the immune system is losing its mind and attacking self-tissue. And then you can backtrack from that and say, why would the immune system do that? Right? To dig deeper. But at least we have that starting foundation of like the physiology of it, of like the immune system is a focal point for those diseases.
Right.
Versus IBS, where it literally tells you nothing. Like, oh, your gut is irritable. Is it because of the nerves, the muscles, the immune system, the gut lining itself, the microbiome? We don't know from that diagnosis.
Right. Well, and again, I think you're pointing out too, it is a syndrome. So syndromes are kind of, they're basically a cluster of symptoms is typically what a syndrome is. And again, it makes it really frustrating because I think it also gives the provider kind of an excuse to just be like, okay, we can't figure this out. This is just IBS. We're done. We're going to wipe our hands of this at this point. And then they don't really give any suggestions or care beyond that point that's really useful. I mean, outside of maybe being like, oh, if you're constipated, take Miralax, or like just some very stuff like you could Google instead of paying like $300 for a specialist appointment or something like that.
Exactly.
So again, I think from my standpoint, there's a level of dismissiveness that happens when you get the IBS diagnosis. Mm-hmm. And there's, like what you're saying, there's different categories of what IBS is. Like, it's not one thing. Like, you could have this kind of subset of IBS, or like what's driving the IBS is based, like what you're saying, it's an immune system issue, or maybe it's a digestive capacity issue that needs to be sorted out, or a motility issue, or, there's a hormonal component. You have endometriosis that's just kind of, that's leading to the IBS symptoms. So I think getting a more concrete idea of what's driving the dysfunction is so important, but it doesn't happen with the IBS diagnosis because the diagnosis in and of itself is almost dismissive in a way. It's like, here's your diagnosis. Like, we see that you're having these symptoms and that your gut is irritated, but we're not doing much work beyond that. And I even think, like, I think what frustrates me in particular and I actually like really valued the conversation that I had with that provider, because I think she's either in medical school or a doctor. Yeah. But I think just talking to her, it seems like again, you don't want to create a situation where people don't go and seek help from doctors or try to rule stuff out. And I think we kind of came to an agreement on that. Like, you don't want people totally disrespecting doctors or something and saying like, oh, I'm not accepting this diagnosis or whatever, which wasn't my intention by the post at all.
Yeah,
but
don't stop there.
Right, exactly. Like, try to ask your doctor more questions. Try to find a provider that's going to at least like refer you to someone else that could help too. Like, I understand a lot of times with GI docs too. Like, they are going to be looking for more urgent, like, they're triaging for more urgent things in their minds. Again, it's not to say your IBS isn't potentially very urgent for you or life-altering and really...
But they're looking for life-threatening stuff,
right?
First and foremost.
Right. They're looking for, like, but your mom had a geyser of an ulcer. They're looking for Crohn's disease, they're looking for ulcerative colitis, they're looking for like more pathogenic type things that have kind of way higher risks. So again, like, in their mind, when they're seeing those types of things, that's where most of their attention is going. And again, that's fine, but I think there has to be some sort of like middle ground in the conventional sphere of like, okay, well, if you can't necessarily, like, if someone gets an IBS diagnosis, there should be more being done than just like, well, here's your IBS diagnosis. Here maybe is like Miralax or Metamucil or something, and be on your way. It should maybe be like, oh, maybe you should talk to someone else, or like a dietitian or someone that can at least coach you on the four like major categories, like movement, stress, sleep, diet. At least try that first. Like, I think it's sad that that's not kind of the next avenue, and there's a lot of issues with the system in general that might prevent that, like, you know, people wanting to use insurance and things like that, and doctors being a little bit apprehensive. I know I talked in my discussion with the doctor who commented on the post, she was saying, you know, from a financial standpoint, some people aren't going to want to do certain testing or explore more just because it's a financial burden, which I totally get. And I think things like, I haven't checked recently, but I'm pretty sure, well, it probably depends on your insurance, but in terms of getting coverage for something like IBS by your insurance could be minimal compared to something like diabetes, which is sad. But like someone with diabetes can go to an RD and it's like completely covered by insurance. Whereas with things like IBS, I think it's a little bit less so. It just kind of depends on the person. But yeah, I think from my standpoint, the frustrating part is that there seems to be this label that's thrown at you, and then not really much else is done by the conventional sphere when they give you an IBS diagnosis. Yeah.
Well, and they probably know on some level that we don't know that much about IBS. Like, because it's not a real diagnosis. Right? Like, if we could more accurately label it, then that's going to lead to better conversations with your providers, better treatment, more accuracy. But I think they know that there are a million different reasons why you could have IBS, and therefore, you know, it like, again, to kind of go back to IBD, at least with IBD, they know that the biologics work really well most of the time. Or at least they know that prednisone works really well most of the time. Because again, they know the mechanism. Right. And they know that there's this auto-inflammatory component to it. So if you can just squash down the inflammation, I'm not saying that's a good thing, but if you could just squash down the inflammation real quick, that person's going to come out of that flare and feel a heck of a lot better very, very quickly. We don't really have anything that's quite that much of a slam dunk in the IBS world. Like, it's not like there's like one medication that everybody with IBS could take and they'll feel like $1 million. We don't really have that. But it's because there's all of these different root causes and different types of physiology that go into it. One person might have IBS because their mast cells are going bonkers and they've got all this like allergy, histaminic kind of like auto-inflammatory kind of stuff. Some people might just have really shit motility, pun intended, and they need to work on that front. Like, somebody could have just like the most wicked dysbiosis you've ever seen in your life. Like, they're all going to be different, so they all need different treatments. But it makes it much more confusing and less satisfying for the practitioner versus the conditions where they have that slam dunk and they could just prescribe, you know, one of like 2 or 3 medications and it works really well virtually 100% of the time.
Right. And I think like probably if you talk to a GI doc, they're frustrated with how they're with the IBS situation, because again, like, the system isn't really set up for them to be able to explore things with the particular patient in any depth. Because like what you're saying, I think the pathology isn't, the dysfunction isn't the same, and isn't as well understood as some of these other issues. Again, IBS is like multiple different things depending on the person. So, you know, I think GI docs are frustrated with people with IBS. They don't know what to do to help, because there isn't necessarily this cookie cutter model that's going to be really overly successful across the board. Yeah. And again, like, I've definitely seen some GI docs go a little bit above and beyond with their care for people that have IBS. So again, like, and I do actually believe as well, it can be helpful to rule out the major stuff. Totally. So again,
you don't want to be the fool who thinks they have IBS, but you actually have cancer. And then you don't treat it quickly enough, and then boom, you're at stage 4.
Right, exactly. So again, like I do think there's potentially some value in excluding the big diagnoses.
Yeah.
And if, again, they test you and you're like, oh, it's just IBS, which can be frustrating and kind of dismissive, at least you know it's not Crohn's, celiac, ulcerative colitis or cancer, like a geyser of an ulcer or something like that's driving your symptoms.
Bowel obstruction.
Right. So, there is benefit of ruling out bigger things too. And then kind of the IBS diagnosis is kind of the your sign that like nothing major is going on from like a disease standpoint.
Well, like a
per
risk
se.
standpoint,
Right.
I would even say. I think like the disease process could still be very severe with IBS,
Right.
but again, it's not going to kill you in the near future.
Right.
That's the thing. Versus like a really bad ulcerative colitis flare or something like cancer, like that could potentially be life-threatening if it's a bad enough flare, or it could at least diminish the quality of life, like, and put you in the hospital for a while.
Well, yeah, and again, I think like the autoimmune, like getting diagnosed from an autoimmune standpoint, I think is also really important too, because like if it's an autoimmune situation, you can have flare-ups. Like, again, certain stressors can just lead to flare-ups ongoing with something like an autoimmune issue, and you might need to have medicines and things like that can help control flares and constant care. But yeah, I think it's good to rule out those major things. Again, more life-threatening type things.
Yeah.
Versus, again, not ruling them out. So it's still important to get some of these things checked out and to understand that there is value in the conventional system. It's just like, once you get the IBS diagnosis, there's not tons that they can do. And I would say, too, I have some clients that are, and this is more the rarity for me, but I have some clients that are a little bit more into the conventional sphere. Like, they'll keep wanting to go there and get help.
Mm-hmm.
But, like, the solutions just aren't overly helpful. Like, they'll kind of be like, oh, I need to go specifically to a GI doc and I really value their opinion more than anyone else.
Mm-hmm.
But again, it's frustrating to them because they kind of hold them as the specialist in the area, but they're just not as skilled, I think, from an IBS standpoint, because there's so many different factors, like you're saying, that are lifestyle, dysbiosis, there could be hormonal components, there could be nutrition components, I mean, there could be vagal tone components, there could be post-infectious issue components, SIBO components. I mean, there's so many different subcategories that you could go down with IBS. And I think it's just too much for that system to take on when they want a nice and clean cookie-cutter treatment plan.
Well, and they just, like all of these doctors are human beings who have a finite amount of energy and a finite amount of time, and they've got to get you in and out in like 10 minutes a lot of the time. And then they have to finish their soap notes, and then they have to, go home and feed their family and do whatever and try to live a life. And this came to my attention more recently too, is that a lot of these doctors are not in control as much as you might feel like they are, because they don't own their clinic. They work for somebody else, oftentimes a hospital, and they have very little control over the tests they're allowed to order, the protocols they're allowed to follow. I have a friend, he's not a GI, but he's a nurse practitioner psychiatrist, and he works in a conventional, allopathic psychiatry office. And I remember he was telling me a while back that if he wants to suggest an herb or a supplement for his patients, because he's pretty into like the integrative mental health stuff.
Right.
But if he wants to suggest that, he has to document it in the notes with at least one peer-reviewed study that was done on humans. Like no animal models, no petri dishes. If he wants to suggest St. John's wort to a person with depression, he has to pull up a PubMed ID number with a study where they studied that herb and it showed efficacy in human beings in a clinical trial. Like if there are supplements or herbs that we hypothesize might work, based on the mechanism and what we know about the patient, but there's no hard data on it, he would not be able to use that. Even if he had the knowledge and the experience and he knew that it would work, he would not be able to recommend it because his boss or like his boss's boss was literally randomly checking soap charts all the time. And if they saw a note of, oh, I recommended this herb to this patient and it wasn't paired with a PubMed ID, he could get fired. And they were checking that stuff. So even stuff like that, like people get frustrated with their GI doctors and their doctors in general because they're like, well, why didn't they recommend a probiotic? Why didn't they recommend this herb? Why didn't they do this? And it's like, they might want to, but they literally can't. Like legally, it could risk them losing their job if they suggested something even a little bit out of the box.
Yeah, I actually she was my PCP for a while. She's an MD. And I think she was more of like a family doctor, but she worked within a hospital system here. And they got on her because she was spending too much time with her patients. Mm-hmm. And so she actually ended up getting fired because she refused to not spend less time with her patients. And I think, again, doctors are... like it becomes a real money game about how many people you can get in and out at times within the system. I'm not saying the doctors viewing it in that way, but the system becomes about getting as many heads through the door as possible. And I even experienced that in my RD internship. It's like all the goals for working with patients is in the hospital network was like, okay, how many patients can you see within a day? And it's like, well, that shouldn't necessarily be the measure of success when working with someone. But again, like when you work with these big hospital networks and stuff, and you're working within a practice or something that's looking on the money side of things, I think it does really stress things more and burn. I think it burns doctors out even more because again, they have to see 40 people in a day, and it's like, that's insane, right? I can't imagine seeing 40 people in a day. So yeah, it's the system is broken in that way where I think the quality of care has definitely gone down in the conventional space, unfortunately, with any kind of issue that isn't a cookie cutter thing. You're going to be hard pressed to find probably a conventional provider that's going to do great IBS care. Not saying they don't exist.
Yeah, they want to.
Right.
They really, really want to help you, but they're stuck in a really crappy system.
Right.
Yeah. But that's all the more reason, it's like, I do think, as always, I'm in the middle of something. Like, on the one hand, there are the chiropractors, the naturopaths, like the hippy-dippy people. And a lot of them are in this mindset of no drugs, no surgery, no normal doctors, never, ever, ever, ever. MDs are all the devil. Oh my God. And then on the other hand, like the same kind of crap happens with conventional doctors. There's so many conventional doctors still to this day who will tell their patients with a straight face that chiropractors are quacks.
Right.
I thought we had moved past that, you guys.
Right.
Like, but there's an equal number of MDs and DOs who say that things are quackery or pseudoscience just because it doesn't fit into their model, and like herbs don't work and probiotics don't work, and IBS has nothing to do with your diet. Like, there's just all of that kind of crap out there, and only drugs and surgery are the answer, apparently. And it's like, why don't we meet somewhere in the middle where, try to do the less costly, less invasive stuff first, But if you need the drugs or the surgery or a scope or something, like tap into the conventional medical world for what they're good at, in my opinion, which is diagnostics. Like tap into them for the diagnostics, rule out the scary stuff, rule out the big hairy scaries, and then turn the other direction when it comes to the treatment. Like they can rule out the big scary stuff. They could diagnose you with IBS or even SIBO. And then you could easily turn around and take that knowledge and go to the more hippy-dippy, the hippy-dippy ways. Come to the dark side. We have cookies.
Right.
You can come over to the side and you can manage things naturally, but you're still getting the benefit of the diagnostics and some of the workup from the conventional side. Like, why don't we try to use both for what they're good at?
Yeah, it's almost like, why would you narrow your toolbox down if you didn't need to? Like, there's still great things in the conventional space that work really well. There's great things in the holistic space that work well. I think, again, both spaces have their major issues when it comes to how they're dealing with IBS. I mean, sometimes people coming to me from the conventional space are better off than people coming to me from the functional medicine space where they've been on restrictive diets for 5 years and have done 7 rounds of herbals or something and have totally depleted their microbiome in a number of different ways.
And their bank account from all the supplements.
Right. Have food fears, have like trauma from just dealing with this constant restrictions and constant sort of care that they're dealing with and not making much progress. And I think like sometimes my clients coming out of even the functional space can be in a much worse headspace, I would say, than some of the GI, like coming out of the conventional GI space. And I think maybe it's because like sometimes in the and I know we've talked about this before in the more functional integrative space, sometimes they're so intense about some of the protocols, like they almost scare the pants off people with like, you have to do this or else you're never going to get better. Or like, you have to follow this this diet to a T. And again, some of those diets aren't helpful at all and actually can be harmful, especially in the long term, which I know we've beaten that topic to a dead horse. But
we'll do it again and again.
And we'll beat it. We'll beat that horse again and again, but not actually, because we like horses here.
Yeah,
right?
we like animals. We like horses.
Right.
We're nice people. But yeah, and you know what has driven me bonkers for a while too is like this idea that you always have to do a diet super strictly is almost always ludicrous. If you have an allergy or celiac disease, or maybe if you have a genuine food sensitivity.
Right.
Like genuine, you got some, IgG or Cyrex test or something, and you cut it out for a while, and then you tested it out and you confirmed, oh yeah, that really doesn't sit right with me. Like if you really know you have a food sensitivity, then those are the sort of things where like even a little tiny bit is going to piss off the immune system. Right? Like you can't take a kid with an anaphylactic peanut allergy and be like, oh, but like one bite of a peanut butter cup is fine, right? Like, no, absolutely not. And you can't tell a celiac, oh, one bite of the bread is going to be fine, right?
Right.
Like, no, it's really an all or nothing thing with those situations where the immune system goes bonkers. But shy of that, like 90% of people that are on diets have the physiological wiggle room that they could eat a little bit of something off of the diet. Like if you're doing low FODMAP, you could probably tolerate a small serving of like one FODMAP thing. Even if you're genuinely intolerant to those foods right now, you could probably get away with a little bit here or there and it's going to be okay. If you're histamine intolerant, you could probably get away with a single serving of, strawberries or whatever it might be, or a teeny bit of lemon juice, and it'll be okay. But if you overdo it, then you might feel the consequences of it. But that's the thing that kills me too in the functional space is that there's this, and I've talked about this before, I really think that they're just trying to scare their patients into being compliant because a lot of these practitioners are deeply frustrated in different ways compared to conventional docs. And I think at some point, a lot of functional people get into this headspace of like, damn it, my patients aren't listening to me. They're eating the pizza on the weekend or whatever it might be. I need to scare the willikers out of them to make sure they're compliant because the protocol's not working and I think it's their fault. Therefore, I'm going to put these scary thoughts in their head and I'm going to tell them that they have to follow it to a T, when in actuality, it's usually not true. Like, you could have some wiggle room with like 90% of the diets you've ever tried and you'd be fine.
Yeah, I totally agree. I believe too, like, your diet should make your life easier, not harder. Just as a general rule of thumb. And again, like, if you're having tons of reactions, like if you have a non-celiac gluten issue, and if you eat gluten and your life is just misery when you have gluten, then taking it out would make your life easier. But again, do you need to be gluten-free and FODMAP-free if you do okay with some FODMAP? So it's like, what ratio of, and what is going to work for you and make your life easier? I think something that's really important to pay attention to. I think sometimes we just are making our lives way harder than they need to be with some of the restrictions. And there's a lot that goes into that. It's not like you're trying to make your life harder at all. You're trying to get healthier in a lot of ways, but it's just, it's in reality, it's not the best option. And I think, again, like, in the IBS space in general, to me, it's just so important to experiment and be able to, like, be mentally okay with experimenting. And physically too, like, knowing, oh, I'm going to dabble a little bit in this food, see how I respond. Like, to me, the experimentation process is so important to help you determine what diet is going to make your life easier. And it's really hard to know that if you just stay low FODMAP forever, or you stay, on a bunch of AIP or something forever. Yeah. It's really hard to know that if you're not kind of trying to re-engage and build tolerance to some of these foods again. But yeah, I think the IBS space, it's interesting because low FODMAP tends to be the go-to still. Yeah. I would say, both conventionally and in the holistic space. Yeah. And there's certainly people in the IBS space that do well with that, especially short term. And then there's people that don't get any benefit from low FODMAP too. And there could be different mechanisms to that, like in terms of what's driving your IBS might be a little different depending on if, like, you're someone that reacts poorly to a lot of FODMAPs versus someone that doesn't. So again, it can give you some good data points too. I know we were talking about, digging to some of the root causes of what's driving your IBS. Sometimes how you're responding to some of these diets can be helpful to point you in a good direction as to where to go or what to explore from a root causal standpoint. Yeah.
Well, and that segues beautifully. So I was going to suggest also that whatever treatments you're doing, whether it be dietary, lifestyle, herbal, medications, knowing the why behind it can be helpful. Right. And it doesn't mean that you have to obsessively go down the PubMed rabbit hole and read. But, like, if you look at your list of supplements right now and you don't know why you're taking some of them, go back and ask the person who prescribed them or recommended them, hey, could you remind me why I take this and this? If it's something beyond, like, a multivitamin, a fish oil, or a probiotic, like, if it's something like a multivitamin, some vitamin D, and a fish oil, like, that's just covering bases and, like, just a good general health practice. But if you're on ashwagandha or a specific type of prebiotic or a specific type of vitamin, like you're on a separate thiamine supplement, like, go back and just check in, like, hey, can you remind me why I'm on this? And that'll help you determine, a couple of things is how long do you need to be on it? Right? Like, if you're trying to do something that theoretically should take like a month to accomplish, you don't need to be taking that supplement 6 months from now. So knowing the why can help tell you how long to stay on that treatment or that medication or herb. Number two, if you know a little bit of the why, then you can start kind of exploring mentally and being curious about what other adjunctive things would be helpful. So like if, just as an example, if an antihistamine like quercetin was helpful for you, the natural kind of progression of thought might be, okay, we're on to something. Like we're going down the right path now. Is there anything additional that I could do that might help kind of further the progress? If quercetin was helpful, maybe I should try some nettle tea. Or maybe I should, try to reduce the dander and the dust and the pollen in my house and get some good air filters. Like you can kind of start thinking through it in that way. And the same thing is true if you try an intervention and it doesn't work.
Right.
That's teaching you that that's probably not going to be the right path. If you try a bunch of antimicrobials and it doesn't do anything for you, that builds the hypothesis that killing the microbes isn't going to be a big part of your journey. If you try a bunch of anti-candida supplements and you don't feel any different, then you're kind of building the hypothesis that candida is most likely not a big deal for you in like the jigsaw puzzle of your health. So yeah, just it goes back to that idea of being like curious and inquisitive and just trying to kind of play with things and figure it out as you go along.
Yeah, and I think too, like looking at, I think if you're someone that has an IBS diagnosis and maybe been working with someone for a while too, whether it's both functional or integrative, and you've been kind of on the IBS journey for a while, I do think it's important to sort of ask the provider what some of the root causal issues are. Again, a GI doc probably, I'd imagine, wouldn't necessarily typically be the best at giving great answers there. They might kind of give you general, like, here are the main things that like we've seen be connected with IBS. But again, I would try to find someone that can help you strategize as to what the root causal factors are, what makes sense to address first, like what are the obvious things. Like whenever I work with someone that has IBS or SIBO in general, it's like, okay, maybe they've seen like 4 different providers or something, and they've done a lot of fancy stuff, but like what is the obvious thing to me based on all the information that I'm taking in that could be a factor for their case? And again, that's taking in what you're saying, what has worked, what hasn't worked, what does their testing show, what are their symptoms saying. It's synthesized, right? Like, it's synthesizing a lot of that information.
Yeah.
Go ahead.
Yeah, I was just going to say, like, were you normal up until you got food poisoning?
Right.
Like, that's pretty telling. Did you feel normal up until you started getting reflux and then you took a PPI and then your IBS reared its ugly head? Like, looking for... my ears always perk up when I hear, and I was never the same since.
Right.
Like, those are like the magic words to me when we're going through a health history. And it's one of the questions I have in my health intake questionnaire is like, was there a point where you felt like you weren't the same after that? And that can tip you off to triggers and root causes too.
Right. And that's such a great point. It's so interesting working with people because some people are like, well, I've been constipated ever since I was a baby, or like I can't really pinpoint where this was ever normal. And then you have other people that are like, oh, I was totally fine. Like I had an iron stomach until, I had this incredibly stressful, traumatic thing happen, or, like what you're saying, an infectious incident where they got a stomach bug or food poisoning or something. Yeah. So all those things I think can be really helpful, but I think it really takes taking in a lot of like qualitative and quantitative data and synthesizing it in a way where you can say, okay, based on all this information, here are the most probable culprits. But even from that standpoint, there's some degree of experimentation too. Like some things are really obvious and probably super true when I talk with someone, and then there's some things that we're like, I'm pretty sure, like I have a strong hypothesis that this is going on. We can try something and see sort of how you're doing. with experimenting with it, does it help, does it not? That gives us more information. And again, like, it's important to recognize that whenever you're working with IBS symptoms, it's a process. It's kind of about really, again, to me, it's about pinpointing the obvious things first and kind of addressing those things first and seeing sort of how someone responds. Sometimes that just takes care of the problem. Like, best case scenario, like, the obvious things were obvious for a reason and like they take care of the issue, but sometimes it takes a little bit more nuance and digging to kind of see what's going on. But I think the important thing is just continuing to peel back layers. I think that's the other thing with that I see with my clients is sometimes people stop at a point. Like, they're like, oh, I have low stomach acid. And so they take HCl or something, and that helps their symptoms, which is amazing. Like, I'm so happy that this is helping. But it's like, we need to try to figure out maybe why your HCl is low to begin with.
I mean, in an ideal world, right? But
right.
I will say, I might have mentioned her before. Like, I remember one woman that I worked with, and yeah, betaine HCl was like life-changing for her.
Right.
Phenomenal. Like, she went from having diarrhea like every day or every other day to like no diarrhea whatsoever for like 2 months. And she checked back in, and I remember she was one of those people, not uncommon, by the way, who was, I think, immensely stressed and way too busy. And she was in complete denial. And, you know, like, she has 2 kids. They both were in like 8 million different sport things. And she was schlepping them to all these different activities. And she was working. And she had a million things on her plate. And I remember when we had a call and she was telling me about the wonders of betaine HCl and how it changed her life. And I remember kind of gently bringing up this idea that, yeah, and now you can start exploring how to make your own stomach acid. Here are some of the things you might consider, like slowing down, taking time to chew your food. And you could just tell, like, she was having no part of it.
Right.
And, you know, it's like, who am I to say that that's wrong? Like, okay, if you want to lead your busy, stressful, crazy lifestyle and just take a boatload of betaine HCl pills, you know what, man, you do you. I think that's silly. I think I would rather not spend a whole lot of money on pills and have to carry them in my purse everywhere. And I would rather like help my body do things naturally. But it's your life. Like, you go live your life and you do you, man. And who knows, maybe like a year from now, she's going to reach back out and she's going to be like, wow, stress caught up with me in this other way. I think you were right. Let's talk about it. But, you know, it's like, you have to meet people where they're at. And she was not willing to really work on the stress and the busyness. And it's like, all right, well, keep taking your pills. Take out stock in the company that makes those pills that you love so much. You might as well.
Right. Well, yeah, I think you have to meet people where they're at. You can't, if their goal is just to kind of mitigate the low stomach acid symptom, and that's good enough for them, then that's great. I think a lot of times, though, people don't want to, again, take the boatloads of HCl, or like, at least the people that I work with. I've certainly worked with some individuals like you're mentioning too, where it's like, oh, they're just happy kind of managing with this slew of supplements, and that's totally fine too. Yeah. But I think, again, like, there's cases though where like people are just kind of stopping at like at a particular point and not peeling back as many layers as maybe would be helpful. Like, they're almost there, they're just not quite there.
I'll throw this out, though, to not exactly be devil's advocate to what you're saying, but maybe a little bit on the other side. I think that just the general like pursuit of a better knowledge of your body and like figuring things out is great, but that's also really exhausting. and it can be very frustrating. So I've had people, who I've worked with for a little while, and then they vaporize for maybe like a year, and then they come back, and I've had other people who like have worked with other providers, and then they take like a year or whatever, and then they find me. And when we talk about their journey, I've heard several people who are just like, honestly, I was burnt out. Like, I was sick of putting forth all this effort and still feeling like crap. I was sick of spending all this money and putting my hope and, putting all of that into that basket. And I think just getting to know another provider and getting to like trust them, and then in some way having that trust broken or putting your hope in them and having that hope kind of dashed away when you did all the things and you still didn't feel better. And it can be really, really exhausting to continually be pushing forward and continually be seeking the answers. And I think it's reasonable that some people want to take a break and just be like, you know what? I just want to be a person with IBS who like manages it the best I can on a day-to-day, and I'm just going to take the Miralax and be done with it for a while because I don't have the wherewithal in me to pursue answers for a while.
Yeah, I think that's perfectly reasonable. I've definitely done that in my case as well. Like, I think there should be periods of time where you're able to regroup and recharge. And again, maybe you find some sort of you're doing the things that can kind of help mitigate and manage the situation currently, but you're not doing anything proactively. And I think that that can actually be a really important part of the process too. Like knowing when to slow down and not do and actually probably live your life more. So again, it comes down to like the IBS journey life balance. Like you don't want that to get so off kilter that your whole life becomes consumed with IBS. Like to me, again, I think one thing I'll always look out for with my clients is if they're like, oh, I'm gonna do this when my IBS is done, or like I'm gonna I can't wait to like start dating again once my IBS is done, or I can't wait to travel more once my IBS is done. But like sometimes not doing those things at all, like to any degree, is actually keeping you stuck. So I think there's an aspect of that too, which is kind of, to me, what you're saying. It's like you have to be able to balance your life, and there's periods of time where you put a lot of time and energy into strategies that might not work and that can burn you out, and you're probably better off taking a break and trying to engage in your life a bit more than trying to go down rabbit holes with another provider. Like sometimes those breaks actually lead to breakthroughs. Like you can actually notice, oh, my symptoms improve when I'm not so intense about about
fixing it.
Right, about fixing the problem. So again, I've definitely experienced that, I think, in my own journey, and have seen that with clients too. It's like trying to find ways to where they're less intense about the process. And I think sometimes too, like, because there's so much trauma, I think, from potentially previous providers and that sort of thing, like what you were saying, just like, oh, things haven't gone as well. They've been at this for a long period of time. I think, it's one of those things too, where sometimes I'll have clients that are more kind of trusting, and they're just like, oh, I'll do whatever you say. Like there's less of a need for deep understanding of everything. And I think we're both pretty good at educating people to know, like, oh, this is why you're taking this thing. But there's some people, again, like it's just, oh, well, we're pretty like trusting, and again, probably depending on where they are in the process. And then you have some clients where it's like, oh, it's like questioning every single aspect that you're doing. So they're already kind of coming to you with less trust to begin with, versus just kind of trusting the expertise of the provider. And it's not to say you can't question things, because again, certainly you can ask questions, but it's like, if it's like everything becomes like a long conversation, like in those cases, you're probably right. They could benefit from just maybe taking a step back. If you're feeling like, oh, I'm just like not trusting of anyone or my provider at this point, taking a step back might be helpful.
Well, and I think that that's usually indicative of stress, anxiety, or medically induced PTSD or other PTSD, like some mishmash of those things.
Right.
Because like, yeah, I've definitely worked with a fair amount of people who straight up have trust issues. Like maybe not just isolated to me. I imagine not, because I do think generally I'm a pretty approachable person, and like I don't think that I intrinsically like breed trust issues. I hope I don't. But I've definitely had moments where like internally on my end, when I have somebody who's really questioning everything, in a way that makes me think they don't trust me, or like they don't trust my expertise, or like I've had patients, and again, this isn't intrinsically a bad thing, but I've had patients where it's like, oh, well, my dad is a doctor and he doesn't believe in this. Or, oh, my husband is very smart and he looked on PubMed and couldn't find anything about this. And it's like, okay. Like the question in my mind with those situations is like, so why are you paying me?
Right.
Like if you don't trust me and you don't trust my opinion on things, like why are you here? Why are you paying me money? I don't understand. And, and it's like, I just try to meet people where they're at. And like gain their trust slowly but surely. But yeah, I've seen that a lot. And I really think that it's some combination of like their background stress level or anxiety level from like, life, and maybe their spouse kind of sucks, maybe their job sucks, maybe they're way too busy and run ragged, maybe they have financial stress, maybe they have legitimate PTSD from their past. Maybe they have like crappy sleep. Like I try not to take it too personally when people have these trust issues, because I really don't think it's intrinsically me. But it's like I've got to meet them where they're at and slowly gain their trust so that we can improve their health. But I had another thought to share really quick before it flies out of my brain. I had to grab a notebook real quick because I wanted to make sure I was quoting it correctly. Going back to what you said a few minutes ago about you kind of keep your ears out for people when they say, I will do this when my IBS is gone, or when my SIBO is gone. There's this great framework that I've heard through a business mentor before, and it came up again on a trip I was on. A lot of people have a have, do, be mindset. So for example, when I have the money, I will do these things with my son, and then I will be a good dad, right? Or when I have the time, I will make this time for self-care and get a massage or acupuncture or whatever, and then I will be a more balanced person.
Like I'll be well, I'll
be healthy. Or like when I have, the cure for my IBS, then I will do all of these things and then I will be happy. But to get a little bit into the woo and a little bit into like the world of manifestation, which I'm not an expert in necessarily, but I think it kind of flows into that a little bit. If you could take that have, do, be idea and flip it, it almost kind of is reminiscent of fake it till you make it in a weird way, which I hated that saying in school, because like it would come up sometimes clinically, like, well, if you don't know what you're doing in the clinic, just pretend and like just have the confidence. So and like I get it in a way, because really I think what mentors were trying to say to us students at the time was, please God, don't freak out your patients, and don't act like this is your first day in clinic. Like just, you have to be confident even though you don't feel confident, so that you don't freak out the patient when you're adjusting their neck. So I get it in that aspect, but it's like, try to flip it and say, I'm going to be the kind of person who has this thing or does this thing. Like, if you want to be a better parent, go be a better parent. Like,
Right.
go do something, even if it requires very little money to do. Like, take your kid to a park, take them on a walk on a nature path, go, do something that is within your constraints, your time and your money and whatever. Like, just do what you're able to do, even with those constraints. So it's like, if
Right.
you could go, instead of have, do, be, turn it into be, do, have. I'm going to be the person I want to be. And then that will start encouraging me to do these things, like bring up these behaviors or these traits. And then hopefully you can have whatever it is that you're seeking. But if you wait until you have the thing to be the thing, you're never going to be the thing.
Right. And again, it brings me back to some of the conversation we had with Dr. Franklin back in the day, where it's like, in order to kind of have like balance, like especially nervous system balance, to you have to have joy, you have to have pleasure, you have to like have some of these things in your life. And I think sometimes we just shut off any of the pleasures and joy because, again, we are dealing with these symptoms and they're kind of overwhelming anything. They're overwhelming and consuming kind of our thoughts, life scenario. And I think you're right. There has to be a balance. And maybe you can't go to the park every day because your energy is a little bit low or your symptoms are high a particular day, but you could go one day a week or something, and that feels like within what you can do, again, constraint-wise. Again, I've told this story a million times, like playing basketball. I was always like, oh, I can't play basketball because I have SIBO and I, have low energy and that sort of thing. But I was able to do it, but I had to I figured out that, I could play 2 quarters, but probably not like 3 quarters. So I kind of had to know my limitations, but I was still able to do it and get the benefit out of it and kind of grow in my tolerance to be able to tolerate more basketball. But yeah, I think it becomes a little bit like this all or nothing mindset that can be problematic for a lot of ways. And I think, again, like it keeps people sicker if you're sort of feeling like, oh, I can't live my life at all until these symptoms are gone, or I can't kind of go on the trip I want to go on until this is totally resolved. Instead of like, oh, if I go on this trip, like how can I manage this trip a little bit better? Like how can I mentally create a framework to go on this trip because it'll make me happy, like what you're saying.
Make it work.
Right. I think, again, sometimes there's just a closing of the door, like unless the symptoms are perfect, we don't even want to engage in some of these ideas. But I have found in my own case and just working with people, the more living you can do while you're managing IBS, the better you're going to do in general. The people that are better at that balance tend to have better outcomes.
Yeah, I definitely think so. And if you think too, especially like a lot of the things that people dream about doing when they get better, like again, or what they dream of being, like, oh, I'm going to get back into surfing, or I'm going to hang out with friends more, or I'm going to go on that trip I've been planning, or I'm going to play basketball, or I'm going to be the better parent that I want to be. You could think of it too, like there's a lot of those goals have a physical component to them of like moving your body differently or being in a different location or like having the sunlight hitting your skin and hitting your eyeballs. And your body is taking that in and soaking that up like a sponge. So it just as an example, like if you are in your house all day, every day with the same crappy lighting and no natural sunlight, and you're looking at the same 4 walls, your body's gonna start adapting your physiology to meet that environment. Versus if you can get outside and again get some sunshine on your skin, on your eyeballs, and like move a little bit more, your physiology will adapt to your new surroundings and your new movement and your new physiology. And one great example that came up just yesterday, actually, I was talking with my hypnotherapist guy about this. He used the example and he said, okay, as a quick kind of like mental experiment, he said, you could try to take on the posture of somebody who's depressed, like, slouch down, frown, or like have a sad face, kind of like close your eyes a bit, kind of like ball yourself up, kind of like getting close to the fetal position, and or just like slump on the couch, and just now try to describe something that brings you an immense amount of joy. Like talk about your favorite hobby or that trip that you went on or your kid or whatever it might be, but try not to change your physiology. Like try to stay in that posture and that slumped, try to stay in that same state while describing something that you love more than anything else. And you're probably going to find that it's really, really, really hard to do. Like some part of you, like you're going to want to lift up your spine a bit, lift up your head, like your eyes are going to want to open up and twinkle a little bit, maybe like a little bit more of a smile, because your body, like that excitement that you're feeling is trickling through your body. Like every cell of your body is detecting that. And similarly, you could try the opposite. Try to like stand up with good posture and be really bright and bubbly and happy. And now try to tell me about something super depressing you saw in the news that makes you wicked depressed. Almost guaranteed, you cannot stay in that same state of like bubbly, happy, oh my God, I'm on top of the world kind of physiology. You won't be able to stay there for long as you describe this really stressful bummer kind of situation. So, if we have the ability to change our physiology, even that quickly and that profoundly, then going to brunch with your friends or eating a food that you enjoy or going outside or moving your body or, doing something different could be tremendously therapeutic very, very, very quickly. So go do the thing. Like, don't wait on it. Just figure out a way to make it work within whatever's reasonable for you. So again, like you said, you knew you couldn't play a whole game. So you played half the game.
Right.
Like that was brilliant. That was the best thing that you could have done.
Right. Yeah, I think you're dead on. I think deep in my SIBO journey, definitely way too much Netflix, definitely way too much time inside, definitely way less socialization than I think is optimal for me. And again, those are things that go amiss. Like, again, they're just usually not prioritized a lot. I think between kind of maybe the functional space, which is very like supplement, protocol-y, strict diet, and then again, the conventional space, which is more just like, we can give you like the very basic things that might help with the symptoms, but we're not going to really be able to help dig much deeper. I think some of these things just get sort of lost in the sauce. Like this, again, the social thing's huge. I think for me in particular, that was a big problem for like maybe a period of like a year and a half where I just was not socializing much. Not nearly. I would say like weirdly, I feel like I have introverted and extroverted tendencies, but like I need a certain amount of socialization. And I think everyone does, and that might differ based on the person, but we're all social creatures. We have to have some degree of connection. And so, it's just so important to not lose sight of some of these basic things that can easily get a little lost in the shuffle of all the things you're trying and doing. And sometimes kind of the re-engagement to living, whether it's hobbies or connecting with more friends or traveling a little bit more or like kind of pushing your comfort zone a little bit can actually be really, really productive.
Yeah, and I don't remember all of like the mental space I was in when I had my IBS, but that is one thing I'm really grateful for, is that oddly, like even when I was having diarrhea every day, and like bloating to a point where a lady asked me if I was pregnant once. And I just about died. Oh my God. It was, did I ever tell you that? It was at a seminar. It was at an Apex Energetics seminar in Irvine. I remember it still, the location even. And it was a woman, I forget if she was a chiropractor or a naturopath, but I had met her like once before at one of these events. And she came up to me and was just so touched. Like I couldn't even knock her down.
Oh my
really,
gosh.
because she
did
was
you let
so
her
happy
touch?
for
Did
me.
you let her touch your IBS baby?
I did not let her touch the baby. But you know, it was like, oh, congratulations. Like she was so touched. And I was stunned. Absolutely stunned. And this, by the way, this was from sesame back in the day, which now my body tolerates totally fine. But I wasn't thinking they had like this little lunch buffet set up, and I got a big blob of hummus, and it didn't occur to me that hummus had tahini in it. And yeah, the rest is history. But like the gut baby was brewing, and I bloated up super badly and very quickly. And yeah, she came like running right over to me, and she was like, oh, congratulations. And I just about died on the inside. But luckily I quickly pivoted, and I decided, instead of just telling her like, no, bitch, I'm not pregnant, I just decided, no, I'm going to deflect, and I'm going to refocus her attention. And I quickly said, no, I'm not, but I got engaged. And then she was all like, oh, the ring. And then we went into that conversation. So I tried to spare her the absolute mortification of, oh my God, I just told her she's pregnant and she's not actually pregnant. So I just immediately deflected to, no, but I got engaged. And then we went on that tangent. But
oh my gosh.
And in retrospect, I could have told her, no, it's my leaky gut baby. Like, it's, no, this is not a human baby.
Well, it makes me laugh because a couple months ago, my husband, I like to, sometimes it's funny to see him squirm, but he accidentally, he like thought he heard my cousin say that she was pregnant, but she didn't. And so he was like, oh, you're pregnant. That's like great or whatever. And she was like, no, like you never like ask a woman that or whatever. And he was like, oh, I'm so sorry. Like he thought that he heard wrong. And then I was sitting there just like, oh my gosh, you've gotten yourself into this dilemma. But it was,
at least it was something that he thought he heard. And it wasn't based on her appearance, though, because that's where people really get in a pickle. Like, if you say a lady is pregnant and she's like, no, I'm just fat. Like, oh man, that is a world of hurt that you don't even need to go into. But if it's like, oh, I thought you said you were pregnant. Like, no, you heard incorrectly. I mean, I don't know. I joke, life with the hearing impaired. I don't have enough of a hearing impairment that you would generally notice. But sometimes, like, if you're far away, or if there's a lot of noise in the room, that's where I have a harder time hearing people sometimes. Or if I'm chewing. So if I'm like crunching on potato chips, forget about it. I'm not going to hear a word you say. But like my husband will say something and I don't even know, like, I don't know what I hear, but he'll say like, can you get me a glass of water? And I'll say like, we don't even have a dog. And he's like, what did you hear? So I sympathize with Armand because I definitely have had a lot of bizarre kind of things. It's like the creative synapses are synapsing, and also like the I didn't hear it synapses, and they're meeting together and forming weird things in my head.
Right. That's funny.
Well.
Oh man.
That's all right. He survived. He survived the embarrassment. Yeah. But again, the woman who asked me was 100% basing that off of my physical appearance. Because I had the leaky gut baby from the freaking sesame that my body was angry at the time. But yeah, it's funny because looking back, I was actually fairly active. Like I went to a seminar like pretty much every weekend, a seminar or a conference. I went out with friends sometimes to like the beach or whatever. Like I would still go to extracurriculars. Like I had a part-time job as a personal trainer. Like looking back now, I'm like, oh, I had every reason to hunker down more, but thank God that I didn't. And I kept I kept living my life, and I would just like excuse myself to have wicked diarrhea
Right,
every so
right.
often or something. But yeah, I just luckily that's how it ended up working out for me. So I never got into like the really severe social isolation and
Lucky
that
you.
aspect.
Just kidding.
Yeah, well, I don't know if it's like my brain's tendency to not overthink things.
Yeah,
And
it probably, honestly, I'm
live
glad
my
that you
life.
didn't. I'm glad you didn't have to do. You didn't do that. I wonder a little bit too, like the timing of when I definitely socially isolated. I had started a new job that was fairly stressful. Like, it was funny, I went back to the job that I had left, like, a year after I left it, and there was 5 people, like, doing what I was doing. So it's like, again, like, it was one of those situations where they made a new role, but, like, it was way too much work for one person at this company, and then my boss got let go, who was, like, awesome in the middle of it, and then I was taking on, like, his work. It just got crazy. So, and that was like my first real job out of college anyway. So there was stress from that. And then I had moved. So there's just like a lot of life changes around that time too, that I think probably added to my situation being a little bit like, oh, dicey. And then I just got into bad patterns. I think once you're in the pattern of it, of being kind of socially isolated, it gets a little bit harder to get out of too. Because sometimes you even lose touch with, like, some of your friends, too, like, that maybe you're regularly seeing. And then it's kind of the energy expenditure to get out of the hole of, like, being a little more socially isolated is harder. So it's like, oh, yeah, shoot. Like, I haven't talked to this person in a number of months. Or, again, maybe 6 months or something. And it's been a while.
You reemerge out of the hole and you're like, hey.
Right, exactly.
What you been doing while I've been in the hole?
Exactly. Well, and I think, like, if you're kind of socially isolating, your friends also kind of know that. And so sometimes, like, friends kind of give up on you a little, which sounds bad. But, like, again, I think it's just natural for them to be, like, not to be top of mind for them. If, like, whenever they ask you to do something, you're like, no. Like, again, there's only so much. Right. And again, like, I will say I had some great friends, like, through that time frame that would still, like, would continuously ask me to do stuff, even if I was like, no, I'm not doing it. So it's interesting, like, I think going through what I went through, like, seeing some of the friends that didn't, like, were pretty consistent about asking you to do stuff, even when you kept saying no, and then there were certainly friends that were like, okay, I've asked her to do, like, 2 or 3 things, and she doesn't want to do it, I'm just gonna, like, kind of lay off. Which I understand both perspectives, too, but it's just interesting. And it could be
they're just trying to give you space, too. It might not even be, like, giving up, but I think that could happen, too. But I think it's just like, okay, she's maybe dealing with some stuff right now, so I'm gonna give her the space. And when she wants to re-engage, I'm going to assume she'll come back to me.
Right. I just think it's kind of different personality types and how they handle that situation. I don't think it's necessarily, like, a good or bad thing. It's just kind of interesting seeing, like, the social dynamics among different people and how they respond to a situation differently. But, I think, again, like, that was just a very hard time when you're more socially isolated. I think it just really is going to affect physiology in a lot of different ways. And so the more you can kind of engage, even if it's challenging, the better.
Yeah. Yeah, I think so. And just think about what would bring you joy right now. Like, if you could do whatever you want right now, no IBS, no nothing, like, what would you do? I mean, if it's something like jump out of an airplane, I mean, you've got to plan that shit. You can't just go do that on a whim. But if it's like, I would go walk outside, or I would go lay out in the sun and get a suntan for half an hour, like, go do it.
Right.
Or I would call that friend so-and-so, but what if they don't want to hear from me? Like, don't overthink it. Just call so-and-so.
Right.
See what happens. I guarantee they will be just thrilled to hear from you. Like,
exactly.
I don't care how long it's been. I'm always thrilled to hear from my friends. So, go do it. For sure. Well, for sure, my darling, I'm I don't know if we made anybody more aware of IBS.
I know. I feel
episode.
Like I know.
These awareness months kill me in a way. It's nice that different diseases have like a dedicated month or a day or whatever.
Right.
But I do always laugh, like, who named these? Like, Awareness Month. Who was not aware of breast cancer?
Right. Well, also,
who's not aware of IBS? Like, these are like commonplace.
And is there a particular reason why April is the month? You know,
it is a higher histamine month. Maybe that's part of it. I don't know.
Maybe
the mast
lots
cell
of rain. Lots of rain.
Yeah.
I don't know.
Which then makes my brain go to diarrhea.
that me too. Me too.
Oh
we were on the same.
Okay. All right. I think the histamine thing made a lot more sense, but yours was deeply disturbing.
Well,
now that I can't get that image out of my head of diarrhea raining down from the clouds. No, it's God. We just traumatized everybody on this
We
podcast.
shouldn't end it on that note, probably.
No, and we won't.
The diarrhea rain. Yeah.
But, I was going to say, years ago, I proposed on some social media post, I don't remember where, that maybe instead of having awareness months, we should talk about like IBS Prevention Month or Breast Cancer Prevention Month. And talking about that element, because again, like all of these conditions that have awareness months, generally everybody's aware that they exist.
Right.
And it's not that we need more awareness, but it's like if we can talk about how to prevent them, how to treat them or manage them, how to screen for them. So like with the case of cancer, like last month was Colon Cancer Awareness Month, and we had that episode with my naturopath friend, and he told us about those little cards that you throw in the toilet and it turns color if there's occult blood in your stool.
Right.
Fabulous. That's the kind of stuff we should be doing in these months. We should be talking about, like, what do you do if you have this thing? And how can you prevent it from coming back once you get rid of it? So I think, a lot of it goes back to, and Lord knows we have 8 gazillion episodes on these topics now for people to go enjoy. But I think, like, live your life to the fullest and don't underestimate the power of connection with other human beings, connection with nature and animals, and doing things that bring you joy just because they bring you joy. They don't have to have any other merit aside from they just make you happy. Try to eat a healthy diet. I'm going to put that in air quotes. Like, go back to what we thought was a healthy diet 50 or 100 years ago. Like, don't overthink it and think about the oxalate and the histamine and the carbs and the grains and the this and that. Like, don't get caught up in the nutrition kind of dogma and bullshit of the world. Just go back to, like, what would humans have eaten, like, 100 years ago? And they would have thought that was reasonably healthy. Like, just eat that. And yeah, just, like, hydrate, move your body, get enough sleep. Like, do the unglamorous things, and you're probably going to see some pretty glamorous results, if I had to guess.
Yeah, for sure. It's like getting back to the foundational pieces. I think for most people can push the needle. You don't want to skip the foundational pieces for some of these like sexy things that are out there, which can certainly be helpful. It's not that they can't, but like, I think sometimes we put the cart before the horse in the IBS space. So the more you can kind of ground yourself in the fundamental things that are going to optimize health and GI function in general, the better off you're going to be. And the more responsive you could be to like any sort of added stuff that you're adding in as well. It limits the need for added stuff, but also if you do need a little support from like a probiotic or, HCl or something like that, it's going to be way more helpful if you're doing the foundational pieces too. Yeah.
Well, and I would add, like, try to build yourself an IBS proof body.
Right.
And then, once you've made some headway on that front, then you can think about the snazzy things. But I agree. I think that very, very frequently the cart is put way before the horse. And
right.
Like, I'll
We've done a lot of horse things today, by the way.
I know. We should just title this the horse episode, and then we're going to confuse people so much. They're going to have to click on it just to see why we named it the horse episode. That's it. I'm telling Carla, we're naming this the horse episode. It's done. Oh
my gosh.
But, I laugh because, I had a great example of this with the last group that went through FODMAP Freedom. And I tell them this in, the first kind of module of classes, and I literally have a graphic that I found on, Google image search.
Right.
Where it's, a cart and a horse, and I talk about not putting the cart before the horse. And there's this whole shtick. And I remember it was, the week 1 Q&A. And one of our students, coincidentally named Nikki, weird, Nikki starts asking me about, there's this fancy proprietary snazzy CBD oil that's supposed to be really good for healing leaky gut. What do you think of that? And I had to tell her, I was like, no, you stop this right now. You are not ready for this. It's probably going to be a waste of money. Not that it's not a lovely product, but there, at least in FODMAP Freedom, leaky gut is module 8 of 12.
Right.
You have 7 weeks worth of material to cover and foundations to lie ahead of you before you even have permission to think about leaky gut. So stop it. She ended up buying it anyway, and I don't think it profoundly helped her, but it's, we're all kind of looking for the fancy, sexy, special thing that makes all of these big, bold claims. And it may or may not work out for you, either because the thing doesn't live up to the hype, because it's just not as good as the company says, Megaspore, and they hype it up way more than they should. Or it might just be that you're not ready for that part of the journey. You're on the 5th layer of the onion and you haven't even peeled back the outermost skin. You have to get there first in order for that to actually take the effect that you want. So yeah, I think that a lot of times, again, it's people get kind of a dead end with the conventional world. Oh, you have an irritable bowel. Good luck. See you never. Take some Miralax. And then people start doing a Google search or a Facebook search or whatever, and they try to find their own answers, which is commendable and understandable. And then, inevitably, the internet starts targeting you. So you get all of these Instagram ads and YouTube ads and Facebook ads and Google advertisements for all of these snazzy things. I swear to God, if I get one more Instagram ad for Dr. Ruscio's Elemental Heal, I'm going to lose my mind. As one example, because all of my Instagram feed on my professional account is all IBS and SIBO stuff. So whenever I'm logged into that account, I get just nonstop ads for Dr. Ruscio's stuff. And I crack up because I'm like, nope, we did a whole episode about this bullshit. No, actually 2 really, if you count the prokinetic episode where I ranted about that. But yeah, it's the internet is always going to try to sell you something. So be really cautious with using the internet in any way, shape, or form in your healing journey. But yes, I don't know where else I was going with that. I kind of lost my train of thought, but hopefully you can pick it up from here.
Well, I think we were wrapping it up probably anyway. But again, I think, it's more about trying to make sure, I like what you're saying about building an IBS free body. Yeah. I think, again, I sort of view that as resilience. Mm-hmm. Resilience takes time to build. And again, I find that some people get really frustrated if they have a bad day or something, which I get. It's really frustrating to have a flare up if you were doing well. But I also think are those flare-ups happening less and less? Are they less severe? Again, there's different things to monitor progress, but I think the key is that you want to build a resilient body so that those things happen less and less. And again, so many of my clients get caught up like what you're saying, the fancy stuff, that they're not necessarily doing as many things that are just naturally going to build resilience.
Mm-hmm.
And again, it can keep them stuck if again they're putting the cart before the horse and not doing the foundational pieces.
Yeah. Well, and I'll share kind of a metaphor to picture this in too, because I think this can be helpful. Have I ever shared the metaphor of the cliff, or I might have called it the gutter?
Yeah,
Maybe.
I think you have, where it's like you get out of the gutter and then you want to get as far away from the gutter as possible.
Yes.
Which takes doing different things to kind of make you travel away from the gutter.
Yeah. Yeah, and to kind of repeat it here, in case this is your first episode with us, basically it's like you can think of this metaphorical gutter or edge of a cliff. I kind of picture like the Grand Canyon. And in this scenario, standing in the gutter or dangling off the edge of the cliff, like fingernails on the edge of the cliff, that would be when you have symptoms. And when your feet are planted on solid ground, that is when you have zero symptoms. But there's a heck of a big difference between having no symptoms, feet firmly on the ground, but your pinky toe is starting to dangle off the edge of that cliff because you're right there, versus not even being in the state of Arizona. Like, if we're using the Grand Canyon, like the person who's standing on the edge of the Grand Canyon is going to be in a position to be perturbed more easily, as opposed to somebody who's in upstate New York. Right? So it's like your first goal with any sort of healing journey, IBS included, is to get yourself to a point where you no longer have symptoms. And then a lot of us, like our brains are really good at differentiating that, like symptoms versus no symptoms. We are aces at determining that, and we notice that pretty quickly. What we really stink at is determining the difference between teetering on the edge of the cliff, like one foot on a banana peel, the other foot on the edge of the Grand Canyon, versus being far away from the cliff. Because as long as you don't have symptoms, you think you're good.
Right.
And it's like, that's where, it's like you feel like most of the work is done, but there's probably more that you could do to support your body and like further optimize your nutrition, or work on your sleep, or work on your stress, or, take like an herbal tea to help combat stress. But that's the stuff that is going to gradually, do therapy, whatever it might be. That's the stuff that gradually nudges you further and further away from the cliff edge. Because in the first scenario where you're kind of dangling on the edge, one foot on the banana peel, one foot into the Grand Canyon, any little bit of like somebody could blow on you or just like flick you with a finger, and that's enough to make you go back into the gutter and have symptoms again. Versus, again, in this analogy, if you're in upstate New York, somebody could body slam you, like, football style, and you're still not going to be anywhere near the Grand Canyon because you're like 15 states over that way.
Right.
So that's how I picture resiliency, is like, okay, not only do you want to have no symptoms or minimal symptoms, but you want to get the heck away from any physiological state that would be conducive to having symptoms. Right. Yeah, I like that analogy. It's not mine. I borrowed it and modified it slightly from Sam Yannick. He was the first one that I heard it from, and I thought, that's actually like pretty perfect. I'm gonna use that. So I can't take credit for it, but my brain likes analogies and metaphors and visual aids like that, so I share it with a lot of my patients. Well, and now I'm going to try to convert that into something that has to do with a horse. Just kidding. Okay. Just kidding. I can't. Well, okay. No, I'm going to go. All right. As somebody who grew up with horses, I'll take this one. Oh. All right. Those riders in like the circus or whatever, Cirque du Soleil, where like they're on the horse technically, but they're literally dangling off the edge of the horse. And they're hanging on by like one toe that's still in the stirrup. In this analogy, that's like the 1 foot on a banana peel, 1 foot on the edge of the Grand Canyon, is like you're on the horse, but also just barely. You're flopping off the side. You're completely horizontal off of the horse, but you're still technically on the horse. Versus your butt cheeks are pancaked beautifully on that seat. You have the reins in both hands. You are in control of the horse and you're having a grand old time. That's what you want to be. versus getting thrown off the horse. If you are in the dirt, off the horse, that's where you have symptoms. We are very well aware of that, right? Like our brains compute that easily. The difference between, hey, I'm riding the horse and having a grand time versus, hey, I'm on the horse, but I'm dangling over the edge, our brains are not quite as skilled at determining that. I would hope that if it was a real horse, though, you would be able to determine that much. I do wish that for all of you. You'd have some pretty significant brain lesions if you didn't know that you were dangling off the horse.
I'm super glad we were able to revert back to horse analogies.
I mean, it's the horse episode, am I right? We might as well.
All right. Well,
yes. All right. Well, Amy, I feel like I'm more aware of IBS. How about you?
Yeah, me too.
Good.
I'm super aware of it.
Hopefully all of you are well aware, what is this, episode like 88 of the IBS Freedom Podcast? Hopefully you were aware of it to begin with. But hopefully you have newfound awareness of other stuff that we talked about today, and that will help you in your IBS journey. As always, you guys know the drill. Go ahead and hit the like button, comment down below on the YouTube channel, like us on Instagram. She is at Amy_Hollenkamp_RD, and I'm at Triangle Guts on the Instagram. Go ahead and follow us, hang out with us, and we will see you in the next episode of the IBS Freedom Podcast. Take care.